Welcome back to our next class. Okay, uh, I hope you all are doing well as you all are reading your previous classes. So, I'm continuing last where we stopped our class. In which factor we are discussing formulation factors. The factors which affects your absorption is may be classified into three types. What are those? Physicochemical factors, formulation factors, and patient related factors. Okay, have you cleared? Okay. Then we discussed completely about physicochemical factors which influences your absorption. And where we stopped at our last class, that is at formulation factors. So first I would like to recollect what we discussed in last class. Which formulation factors we discussed it? Mainly disintegration, dissolution, as well as the compressional force or manufacturing variables, manufacturing methods. Okay, manufacturing variables are nothing but manufacturing methods. In these manufacturing methods, you have wet granulation technique and all, and then how the compression force will affect your rate of absorption. I discussed all these parameters in our last class. And one more important one, I already told you, in the means of solid dosage forms, that is tablets. Okay, we are discussing all these factors, how they will undergo dissolution and how they will undergo disintegration and how the compression force will be and how it affects on your rate of absorption. So every time I used to tell you solid dosage form means that means it is a tablet. You just consider it as tablet. And then the fourth parameter, the fourth formulation factor which influences your rate of absorption, we will discuss it now. Then coming to the topic, pharmaceutical ingredients or excipients or adjuvants, these are useful to make a dosage form. Okay, so make any type of dosage form, it requires to manufacture it. It requires some excipients which are suitable to make a respectable dosage form, right? So in that cases, we need to discuss about each and individual excipients where you are going to use in that particular excipients by formulating which type of dosage form you are going to use that particular excipients and how it the excipient effect will be on your absorption. You just I need to discuss it now. Okay, first, I'm reading that more the number of excipients in the dosage form, it will be more complex and greater potential for absorption and bioavailability problems. If your dosage form is having more than 10 excipients, it is very difficult to estimate you absorption parameters and how it produces pharmacological effect and all. You need to study about each and individual excipient role and each and every excipients mechanism and how they influenced and combination of which factor it is going to influence on your absorption. It is very difficult. If your dosage form is containing less than 5 number of excipients, it is somewhat easy to describe you where the absorption will occur and how the absorption will be, right? That's what commonly used excipients in various types of dosage forms. What are those? First foremost important one is vehicle. Vehicle is nothing but aqueous medium, okay, or else organic medium, whatever it is. Vehicle, see, rate of absorption depends on its miscibility with biological fluid. What does it mean? The miscibility, that is nothing but the solubility. The rate of absorption of your particular drug is depending on its miscibility with biological fluid. How much extent of your drug will be miscible with biological fluid is taken into consideration. And then next point is miscible vehicles causes Rapid absorption, you all know that once your drug will get dissolved in particular solvent system, definitely just ensure that it will produces rapid absorption. For example, propylene glycol. Okay, this is the vehicle. Okay, it depends on the vehicle will be easily solubilized or miscible with biological fluid, and immiscible vehicles absorption depends on its partitioning from oil phase to aqueous body fluid. See, ma'am, in case of biological fluid, what it contains more number of aqueous fluid, right? In, for example, if your liquid, whatever your drug solubility depends on it somewhat aqueous, or that is water or buffer system, or else it may be an organic solvent, right? So if your drug is not dissolving properly in that particular organic solvent, definitely there is a partitioning from oil phase to the water phase which is present in the biological fluid. So in that cases, what is going to happen? Automatically your drug absorption will be delayed. Okay, for that immiscible vehicles absorption depends on its partitioning from oil phase to aqueous body fluid. So you make sure that your drug will be definitely having some miscibility for fast or rapid absorption. Okay, next coming to diluents. Okay, diluents, hydrophilic diluents imparts absorption, hydrophobic diluents retards absorption. And what do you mean by hydrophilic? This is also already you know that. And hydrophobic diluents are there. So hydrophilic means definitely these are water loving molecules. These are having high absorption. These are producing imparts means these are producing absorption. As in case of hydrophobic, these are somewhat less soluble. That's why they may retards or may they decreases or they reduces. All these terms are synonyms. Absorption, right? So also there is a drug diluent interaction forming insoluble complex and retards absorption. See, ma'am, in some drugs there is a drug diluent interaction is happened. In that cases, definitely there is a chance to form a complex. That formed complex will be a insoluble. Automatically, if it is insoluble, it retards your drug absorption. So the example is for that tetracycline DCP. DCP means dicalcium phosphate. It forms when you take this tetracycline, okay, along with this diluent DCP, dicalcium phosphate. It leads to formation of an insoluble complex. It alters your absorption, that is it reduces your absorption. So the diluents are useful to make the solid dosage form, that is tablet. While going to prepare a tablet, you are going to use diluent as a one of the excipient in the formulation or composition of tablet. Okay, clear? Everyone has cleared this? Okay, then next come to this binders and granulating agents. I already told you the importance of binders. So these are also hydrophilic binders are there. In that imparts hydrophilic properties to the granule surface, gives better dissolution properties. What are the examples for these binders? Starch, the most famous example for this binding agent is starch, gelatin, PVP. PVP means polyvinyl pyrrolidine. Just write it down, polyvinyl pyrrolidine or PVP. And more amount of binder increases the hardness of the tablet and retards the absorption rate. So you always to use your binder concentration as optimum, which is mentioned as per your IP. For different drugs are having different ratios of binder. So optimum binder ratio will be mentioned in IP, that is that is Indian Pharmacopoeia, right? So these binders are useful to make a damp mass in the preparation of tablet. After forming this damp mass, when you sieve that damp mass, you will get some granules while preparing a tablet. After forming these granules, when you are apply some compression force by using 16 station rotary tablet punching machine or single punching machine, you will get some tablets. So if the binder concentration will be more, definitely there is a chance to get more hardening of your tablet. So these hydrophilic binders imparts the hydrophilic properties to the granule surface. It will give better dissolution properties. So I'm always telling you, you just remind the differences between hydrophilic and hydrophobic, then it will be very easy to write the answer in your examination. Then then come to disintegrants, right? Then mostly hydrophilic in nature. Disintegrants, these are useful to break down your tablet into small particles. The mechanism is nothing but disintegration. Okay, mostly hydrophilic in nature. Decrease in amount of disintegrants significantly lowers bioavailability. So decrease in amount of disintegrants, it lowers the bioavailability. If your drug is having good absorption, it is having high dissolution, it is having high absorption, okay, high bioavailability. This is our main concept now. So decrease your amount of disintegrant significantly lowers the bioavailability of a particular drug. And come to this lubricants. This is also one of the excipient which is used to making a tablet. Clear? Commonly hydrophobic nature. So these lubricants are hydrophobic nature. Therefore, it inhibits the penetration of water into the tablet. Thus, dissolution and disintegration. So what is the importance to add these lubricants to your tablet? There is a chance to absorb water while compressing into a tablet, or else while preparing a tablet. So by the addition of this lubricant, there may be a chance to inhibit the penetration of water into the particular tablet. Thus dissolution and disintegration will be improved. So up to this mark, up to these diluents, binders and granulating agent, disintegrants and lubricants. These are the 4 excipients which are used for making a tablet. First you have to learn what is that. Then what is the importance of that particular ingredient in the preparation of tablets, right? Then suspending agents or viscosity agents. These are very important while preparing suspensions or emulsions. These are of suspensions and emulsions. Suspensions and emulsions are of biphasic dosage forms. These are containing 2 types of phases. One is miscible and one is immiscible. Okay. So suspending agents or viscosity agents stabilized the solid particles and thus affects drug absorption. Macromolecular gum forms unabsorbable complex with drug. For example, NaCMC, that is nothing but sodium CMC, carboxymethyl cellulose. So macromolecular gum forms unabsorbable complex with the drug sodium CMC. Viscosity imparters acts as a mechanical barrier to diffusion of drug from its dosage form to the GI transit of drugs. So the suspending agent, suspension means what? The suspended particles will be redispersed when you are going to use a suspension. That is our main aim in suspension. In case of your solid particles is not freely moved in that particular aqueous medium, or it is not freely redispersed in that particular medium while you are going to use, it leads to the formation of a complex. So this complex may be unabsorbable, so automatically it reduces your drug absorption. That is nothing but the statement meaning. And this is the example for sodium CMC is the example for your suspending agents, right? Clear, ma? Next, surfactants. Then where you are going to use these surfactants? In case of suspensions as well as emulsion preparations only, biphasic dosage form preparations, right? May enhance or retards drug absorption by interacting with drug or membrane or both. So how they retards drug absorption? Surfactants by interacting with drug or membrane or both. So examples are griseofulvin and some steroids. You already know that griseofulvin is a very poorly water soluble drug, right? So in griseofulvin and steroids may enhances or retards drug absorption by interacting with drug or membrane or else both. Okay, the examples are of griseofulvin, steroids. And finally, it may decrease absorption when it forms the unabsorbable complex with drug above CMC. What do you mean by CMC? In case of critical micellar concentration. Okay, this is very important. CMC, critical micellar concentration. The micellus will be formed at solid liquid equilibrium or in aqueous medium of your suspension, and in some cases it may be forms in case of emulsions also. Critical micellar concentration at which the micellar formation is occur, that is nothing but critical micellar concentration. So then by using these surfactant, where it is decreasing the absorption, when it forms an absorbable complex at critical micellar concentration. That is very important. Unabsorbable complex at critical micellar concentration, right? And next, coating. Coming to this again, then this coating is in tablets. In general, deleterious effects of various coatings on the drug dissolution from a tablet dosage form or in following order. So by forming a coat onto your tablet, it may alters the bioavailability or it may alters the drug absorption in the following way. You have uncoated tablets, sugar coated tablets, enteric coated tablets, okay, and coated tablets. So how the absorption of drug will be, and which is having more, which is having less. Enteric coated tablets are having more the resolution profiles of certain coating materials changing. Okay, the effect of coating will be decreases the absorption. See here, ma, enteric coat is more than sugar coat is more than non-enteric coat is uncoated tablet. Here non-enteric coating is nothing but uncoated tablets. Definitely your tablet is doesn't have any coating, means there may be a chance to get fast absorption, right? If it is sugar coat, then next step. If it is enteric coat, it takes more time for absorption. So you already understand the concept and all. So the dissolution profiles of certain coating materials change on aging. Example is shellac coated tablets on prolonged storage. If in case of shellac coated tablets on prolonged storage, dissolve more slowly in the intestine. This can be, however, be prevented by incorporating little PVP in the coating formulations. When you store the shellac coated tablets on prolonged storage, so if you store the shellac coated tablets for prolonged period of time, what will happen? Dissolves more slowly in the intestine. If you have to use these shellac coated tablets, suppose you have used these shellac coated tablets for a prolonged release dosage form, that is nothing but a controlled release dosage form, what may happen? Dissolves more slowly in the intestine. So how you prevent this? By incorporating polyvinyl pyrrolidine in the coating formulation. PVP is polyvinyl pyrrolidine in the coating formulation. Is it clear? Have you understood? And then next, coming to the buffers. Yes, these are very important one in case of your formulating any type of dosage form. Buffers are sometimes useful in creating right atmosphere for drug dissolution, and most of the solvents will be, and most of the drugs will be insoluble in aqueous medium, that is water. So in that cases, the drugs will be more solubilized in suitable buffer, 6.8, 7.2, 6.5. So many types of buffers are there. Generally in lab scale, we have used most of the times phosphate buffer, 6.8, 7.2, right? Okay. So you have citric acid buffer, acetic acid buffer, so many buffers are there. Depending on the drug solubility, you can select your buffer. Is it clear? Then, however, certain buffer systems containing potassium cations inhibit the drug absorption, as seen with vitamin B2 and sulfanilamide. Certain buffer system containing, so see here, ma, I already told you this is the selective buffers are there for each and every drug. So based on the drug solubility in particular buffers, you can select the buffer systems depending on its pHs, right? So in the certain buffers containing potassium cations, they may inhibit the drug absorption of some drugs. Those are sulfanilamide as well as vitamin B12 like drugs. So you just select the buffer before going to make a formulation. You just refer IP and you just then select the buffer which is suitable for your particular drug. That is very important one. And last final one, that is colorants. Even a low concentration of water soluble dyes, you already know that colorants. Okay, about colorants you already studied in previous classes. Dye can have an inhibitory effect on dissolution rate. SEMA, even a low concentration of water soluble dye can have an inhibitory effect on dissolution rate. The dye molecules get absorbed onto the crystal faces and inhibit the drug absorption. Actually, in some preparations only you have to use colorants, coating, and in some solutions. So you have to use this colorants and all. Okay. So if you are used low concentrations also, it may get show some effect on the drug absorption. How they may show effect on the drug absorption? The dye molecules will get absorbed onto the crystal surface which is having your drug. If your drug is having some crystal surface, the dye is go in contact with that crystal surface, then it retards the drug absorption. What is the example? Brilliant blue, the dye. Brilliant blue dye retards dissolution of sulfathiazole. SEMA. Brilliant blue is one of the dye. It retards the dissolution of sulfathiazole drug. Okay. Then next, complexing agents. Complex formation has been used to alter the physicochemical and biopharmaceutical properties of the drug. Complex formation has been used to alter the physicochemical and biopharmaceutical properties of drug. Example is enhanced dissolution through formation of a soluble complex. See, here there is a chance to get two types of complexes. One is either soluble and one is either insoluble complex. If it is soluble complex, definitely you will attain high absorption. See example, ergotamine tartrate, caffeine complex, and hydroquinone digitoxin complex. So these two are the ability to form a soluble complexes. Definitely there is a chance to get high dissolution rate, and finally it attains high absorption. Ergotamine tartrate, caffeine complex, and hydroquinone digitoxin complex. And next important one is enhanced lipophilicity for better membrane permeability. Caffeine PABA. Okay. Caffeine PABA complex enhances the lipophilicity of your drug and for its better permeability. Para aminobenzoic acid, that is nothing but PABA. Caffeine is always used to form a complex with PABA, para amino benzoic acid. Enhanced lipophilicity for better membrane permeability, for attaining definitely good dissolution profile. And finally, the nature and type of dosage form. And now we will see how the type of dosage form will get influence on your absorption, and which type of dosage form is having more absorption. Tell me, it is very simple. Which type of dosage form? Definitely it is a solution form. SEMA. As a general rule, the bioavailability of a drug from various dosage forms decrease in the following order. Okay, solution showing better bioavailability, emulsions, then suspensions, then capsules, then tablets, then coated and enteric coated, and finally sustained release products. Okay, what it is showing, first we will read from this. Apart from the proper selection of drug, SEMA, apart from the proper selection of the drug, clinical success often depends to great extent on the proper selection of the dosage form of the drug. As a general rule, the bioavailability of a drug from various dosage forms in the following order. So bioavailability, if your drug is having, once again I am telling you, if your drug is having highly soluble, it is having highly dissolution, and it is showing high bioavailability. So generally, which type of dosage forms are showing high solubility? solutions. Okay, after solutions, there is a chance to get emulsions is showing good solubility, and then suspensions, then capsules, and finally tablets. Under tablets, one thing, sustained release tablets may release the drug up to prolonged periods of time, that may be weeks or months. So definitely there is a low bioavailability rate. And before that, entery coated is there. Entery coated means the dosage form will get absorbed from the intestine. Definitely it will take some time, and it will get low dissolution profile. And coated is also, it takes some time to dissolve the coat which is covered onto your tablet, you know already. So this is very simple, ma. Once you understand the concept, it is very easy to write and all. So this is about your formulation factors which are affects your rate of absorption. And next important one is type of dosage form. See, ma, this schematic outline of the influence of the dosage form on appearance in the drug solution in the GIT, how the absorption will be. See, ma, when your drug is in aqueous solution, when your drug is in aqueous suspension, when your drug is in solid dosage form. You just here you are going to compare if your drug is having these three types of dosage forms and how the absorption of your drug in the blood or plasma. Just see now, aqueous solution, aqueous suspension, or else it is a solid dosage form. Solution or suspension. Suspension means the fine particles of your drug will be enters into the GI fluids. And in aqueous solution means there is a chance to get some precipitation and all. And immediate release solid dosage forms, definitely the drug is going to get breakdown into small particles. Then disintegration, that process is called disintegration. The breakdown of your tablet dosage form into small particles of your drug is called as disintegration. After it undergoes disintegration, it leads to formation of aggregates or granules. Then it enters into the dissolution part. Then the solution will be available in the GI fluids. This is very simple thing. And in case of solution or suspension, the fine particles are available in the gastrointestinal fluids, and then when it undergoes dissolution, it leads to the formation of a solution of drug in the gastrointestinal fluid. In presence of absorption, it enters into the blood or plasma. This is very clear. This schematic diagram is showing very clear picture how the drug absorption will be in case of different types of dosage forms. And here see, ma, possible intervening steps between administration and appearance of drug in solution in GI fluids. Once you learn the chart, you can write by your own also. And last one is product storage and storage conditions. This is the last parameter of this is the last pharmaceutical factor which influences your absorption, rate of absorption. Then come to this product aging. Product age and storage conditions can adversely affect the bioavailability by change in especially the physicochemical properties of the drug. SEMA, product age, how much age it contains, and storage, where you are going to store it. In some dosage forms, pharmacist will say that you have to store it in 2 to 8 degrees centigrade, and you have to store it in room temperature. So what it indicates? Definitely the product will be degraded in unprescribed storage conditions. So you have to follow those guidelines, product aging as well as storage otherwise your dosage form will get degraded, can adversely affect the bioavailability by change in especially the physicochemical properties. SEMA, once again I am reading, product aging and storage conditions can adversely affect the bioavailability by change in especially the physicochemical properties of the dosage form. For example, precipitation of the drug in solution, or hardening of the tablet, or change of in particle size in case of suspensions. See, ma'am, whatever the dosage form, each and every dosage form is having separate storage conditions, or else they are having separate expiry dates also. Okay, so what will happen in case of your drug will be in solution, there is a chance to get precipitation, or there is a chance to cause agglomerates or coalescence of your particles. That means the clubbing of your particles to one by one, and then it leads to the formation of large particles. That is nothing but a precipitation. It is showing like precipitation. And then if your tablet is not stored properly, what it happens, there may be a chance of getting more hardness of your tablet, hardening. It is not that much flexible. Okay, if your doctor is suggesting you to take half of the tablet, so then in that cases, you cannot cut it into two half pieces if your tablet is more hardening. That's why that storage conditions as well as the product aging is very, very important factors in case of this formulation factor. And finally, change in particle size of suspension. In case of suspensions or emulsions, the particle size will be more important. Okay, so if your suspension is not properly stored, if your suspension is too old, means what happened, there may be a change in particle size. You cannot take it as directly, otherwise it may causes low bioavailability, or definitely it may produce some adverse effects. Okay, this is about your formulation factors which influences your rate of absorption. Till now what we discussed, what are the formulation factors, you always keep in mind while going to read these formulation factors. You just keep it in your mind. You just think it as a tablet or solid dosage form. First factor is dissolution factor, and next factor is disintegration factor. Next factor is manufacturing methods. Okay, wet granulation, dry granulation, or compression force. And last, fourth factor is, what is that? A usage of excipients or ingredients or adjuvants which are used to formulate a different kinds of dosage forms. In this fourth factor, you have to consider all types of dosage forms, right? You have monophasics, biphasics, and solids. Monophasics, single phase, what are those solutions? Biphasic, what are those emulsions and suspensions? Solid dosage forms, what are those? Tablets and capsules. So in that, how first important one, vehicles. What is the main use of vehicles? These are mainly useful for formulating a suspensions. That is nothing, formulating a solutions or syrups. These are monophasic dosage forms. Vehicles are mostly useful to formulate a syrup or a solution. So how the effect is, and then how binders, diluents, disintegrants, and lubricants, these four factors will be effects onto your tablets. And coating also, how the coating plays an important role in your absorption. Either it may be decreases or increases. And what is the order of bioavailability in case of coating? Suppose if it is enteric coated, definitely it will be absorbed from your intestine. Okay, if it is coated tablets or it is sugar coated, based on the drug availability, either it may be absorbed from alkaline medium or from acidic medium. And then uncoated tablets, your tablet doesn't have any coating and all. So these are three types of coating mechanisms and all. And then how the product age and storage conditions will be. Okay, and then these are the various types of formulation factors you have discussed till now. So in that formulation factors, you are going to read these all types of parameters which influences your drug absorption. Okay, ma'am, you don't have any idea regarding the dosage forms and all, no need to worry about. Once you go through the lesson, once you read the lesson, definitely you will get an idea. If you have any doubts, you just contact me. I will definitely explain you once again clearly. But my intention is you have to read it, ma, because you have less awareness as compared with B Pharmacy students, right? You studied only formulations under your third year. So you doesn't have any idea regarding this dissolution and solubility and absorption. Only you just keep it in your mind, only one thing that should be in red mark, you just stick on to your brains. if your drug is showing low solubility, it is showing low dissolution, and it attains low bioavailability. You just remind these three factors. And finally, automatically it is having less absorption. First you consider it as solubility, then dissolution, okay, then bioavailability, then finally it absorption. So if your drug is possessing less solubility, it is having less dissolution, so for that it is showing less bioavailability, and automatically the absorption will be low. In this manner you will read, means definitely you will get a clear idea about all these formulation factors. Till now we discussed about physicochemical factors and formulation factors, how they affect in drug absorption through the GIT. And next class, I will discuss about patient related factors. I hope till now what I covered, you all have an idea, clear idea. Okay, you all have a clear idea. You just go through it and read it, learn it. Okay, right. We will meet it in next class.